lunch, so it is afternoon. We are recording this series, so the recording just started, and by staying on the panel today, you are agreeing to be part of the recorded session. So welcome, everyone. Thank you for joining us this afternoon for the first Lunch and Learn in our 2021 celebration series. It's so great to see so many of you and to have you join this discussion today. So I appreciate you taking time. And if this is lunchtime for you, please feel free to have lunch while you join us this afternoon. Before we get started, I do want to go over a few housekeeping items. Please keep yourself on mute during the discussion. We will utilize the chat box if you have questions, if you want to make comments, if you want to connect with one another. Please do that through the chat function and remain on mute just to reduce background noise, anything like that. Please also feel free to use the reaction buttons if you want to express yourself throughout the discussion today. Take liberty with those. And again, a reminder that this is a recorded session. We will make it available after today's panel. So again, thanks for joining. I'm Chelsea Herring-Cozy. I have the honor of serving as the Executive Director of CHIP, the Coalition for Homelessness Intervention and Prevention. CHIP's mission, for those of you who may or may not be familiar with us, is to mobilize, advocate, and empower community collaboration towards ending homelessness, and to foster an effective system of homeless prevention and intervention in the greater Indianapolis area. We firmly believe that everyone has the right to be housed and connected to care, and that the only way we can achieve that is by working together, because successful efforts towards ending homelessness require the collective talents, resources, and commitment of the entire Indianapolis community. No one group or individual has the ability to address this issue alone. And we are so much more effective and impactful when we bring our collective talents together under this shared vision. These Lunch and Learns are meant to provide some insight into the issue of homelessness here in Indianapolis, as well as to highlight some of the collective work being done by our amazing partner organizations working across the homeless response system. You will hear from several of them today. Before we jump into today's topic and meet our phenomenal panelists, I would like to take a moment to recognize and thank our 2021 celebration sponsors. Thank you for your commitment to ending homelessness in Indianapolis. We appreciate you immensely and could not do this work without you. So thank you to our sponsors. So today's topic is one that I'm sure we all wish wasn't still so relevant. COVID-19. What opportunities and lessons have we all learned this last 18 months from a homeless perspective and from our homeless response system? So I'm going to frame the discussion a little bit today and then really hand it over to the experts who have been on the ground working tirelessly day in and day out in the midst of this COVID-19 reality we have all found ourselves in. 18 months ago, all of our worlds were rocked when we became acutely aware that we were in the midst of a global pandemic and that the coronavirus was quickly spreading across the world, country, state, and our city. As we listened, watched, learned, and anxiously followed the guidance coming from public health officials, many of us began staying home, isolating ourselves, getting all the supplies we needed to have good hygiene and personal protection gear. What so many of us found comfort in was having a safe place to shelter, a home that kept us healthy and protected. But imagine you didn't have that. Imagine if in the middle of a public health crisis, you had no place of your own, to do all of the things we were being advised to do. Imagine if you were living outside, in your car, unsheltered, without access to bathrooms or basic necessities. Imagine if you were living in a congregate shelter with hundreds of other people without the ability to social distance or isolate or connect with services that you so desperately needed because all of a sudden they went virtual. This was the reality for far too many individuals and families who were experiencing homelessness across the country and here in Indianapolis. Just for some perspective, in 2020, there were 8,502 individuals experiencing homelessness in our city throughout the year. On a single night in January of 2021, our point in time count counted 1,928 people who were staying in emergency shelters, safe havens, transitional housing, or living unsheltered in the midst of a pandemic. Those experiencing homelessness are disproportionately Black and Brown households, and increasingly, they are those over 62 and those who have more chronic health conditions. So all of the sudden, for those experiencing homelessness, their housing crisis became compounded by a public health crisis, making them that much more vulnerable to the risks of COVID infection and death. For those working in this sector and those experiencing homelessness, this reality was terrifying. And it only reinforced the fact that housing is healthcare, housing is a social justice response, and housing is the solution. So how did our community and those working in this space come together to respond, adapt, and keep people safe? Let's meet and hear from our phenomenal panelists today to learn more about what these last 18 months have looked like and where we go from here. So if we could take a few minutes, I'll have each of you introduce yourselves, and then we will take the screen away and really get into our discussion this afternoon. So what I'm going to ask each of you to do is just introduce your name, your organization, your position, what area within the homeless response system you work, if there are specific populations you're working with, and then what or who inspires you most, day in and day out, to continue doing this work. So January, I will start with you. Can you go ahead and introduce yourself?
Thank you, Chelsea. My name's January Jeter. I am the outreach social worker with at the VA. I obviously specifically work with veterans. I do street outreach. That's my role in the system. As far as what inspires me to do the work, I think it's a lot of my peers, a lot of the other outreach workers, especially the ones that have been doing it for a long time that I'm sure everyone here knows. They really keep me going and help inspire me. And then, you know, I have kids, and it's always my kids and young people who are coming up and just wanting to leave a better world for them.
Thanks so much, January. Nicole, can you say hi and introduce yourself with everyone?
Thank you, Chelsea. I appreciate the invitation to participate as a panelist. My name is Nicole Westling. I work at Horizon House. I am the street outreach manager and the PBSO coordinator. The area within the response system that I focus is street outreach. Populations that we serve, everyone. And what or who inspires me? So many people, but I think individuals or people in our community, in our world that value love and kindness, imperfections, perseverance, change agents and storytellers, activists, hope and vulnerability and courage. And I am very much inspired when I'm hiking in the mountains and in the forest.
Thanks so much, Nicole. Melissa, can you jump on and say hi to everyone and introduce yourself?
Sure. Thanks for the opportunity to be with you today. I'm Melissa Bell. I work with the Homeless Initiative Program, and I'm their diversion specialist. So I work with individuals and families who are on the doorstep of homelessness, those who are having a housing crisis and who might need access to shelter or who have nowhere to go if we can't find a solution. And who inspires me? Of course, my clients inspire me every day. They're coming up with creative solutions to figure out ways to avoid literal homelessness. And other people that inspire me are those who allow me to continue doing this work, like the childcare workers who are showing up every day, taking care of my kids so I can get to work, and the teachers who are showing up, and all of you. So thank you.
Thanks so much, Melissa. William, want to jump on and say hi and introduce yourself?
Hello, everyone. Definitely a pleasure to be here with you all. Hopefully you all can see me. I had to get my lighting right. Get my good. Anyway, my name is William Bumphis. I work with Wheeler Mission. I am the director of Men's Emergency Shelter here at Wheeler Mission. And in terms of the population, the area that I focus on, I think someone said, I think it was Nicole said, everyone in this population is who becomes my primary focus when they come into the shelter. Who inspires me? Anybody who knows me knows that I love to talk about Jesus. And besides that, my parents, who instilled a lot in me as I was coming up. They always had a love for other people, no matter what they were, no matter what the background was, anything like that. And I learned. I remember I used to come to the shelter a long time ago. It was the Lighthouse Mission then. And my mother and my father would come here and they would preach to the guys, and I would always, come with them. And it was just of course, as you can imagine, as a 8-year-old kid, right? It was crazy, but it always stuck with me to just care about other people and to make sure that you're able to take care of the least of these and give help ups for people who have different situations going on. So again, it's good to be here with you all.
Oh, thanks so much, William. Glad you're here too. Shay, can you jump on and say hi to everyone and introduce yourself?
Thank you. Thank you for the opportunity to be here. So my name is Shay Mays, and I work with the Homeless Initiative Program, and I'm the case management supervisor. So my position works with case management and housing, and we work with all populations, so individuals, families, veterans. We have several different grant programs that we help people get housed. That's the goal. Who inspires me? So I work with a great group of people. I mean, and they are energetic. And so trying to match their energy is definitely a goal. However, I'm like Mr. Bumpus. I come from a church background where we did a lot of outreach and a lot of missionary work and et cetera. But I have one little aunt that she had an old blue station wagon, and she used to go to Cub Foods 2 to 3 times a week and pick up a trunk full of bread. And she would go to the apartment complexes just to hand out. I've never had so many cookies, cakes, and pies in my life, but she would pick me up every Saturday morning, and that was our mission for years. And I continue to be inspired by that and to continue the work that she used to do.
Oh, I love that. Thanks for sharing, Shay.
Thanks.
And Danielle, can you jump on and say hi to everyone, and then we will get going.
Hi, everyone. Danielle Bagg-Wireman. I'm the Senior Director of Impact at CHIP. What populations I work with? So we don't do direct service at CHIP, but I have the pleasure of working with all of the service providers that work in this field and that do the work on the ground. So that's kind of my role. As far as inspiration, and not to kind of piggyback on what everyone else has said, I've really tried to narrow it down, and I've had the most time to think about this, but I've really struggled to narrow it down. But everyone that we work with in the COC is an inspiration to me, and I'm thankful to be friends with a lot of you on social media. And I'm always inspired by January, your posts that you make on street outreach all the time. There's just so many amazing things that are being done in this community. And it's really great to have you all, not only as colleagues, but also to feel as part of my family. So I'm so inspired by so many meetings I've been in the last several years where we can come together as a community and overcome any kind of obstacle that's thrown in our way. And we have so much creativity and problem solving in our community. So that's what inspires me the most.
Thanks, Danielle. All right, so I'm going to stop sharing so you can actually see the real faces of our fantastic panel today. And want to thank you all again for being part of this really important discussion and for really highlighting and elevating the work that you have been in and in the thick of for the last 18 months, longer in terms of your careers, but the last 18 months in terms of this intersection of COVID and homelessness. As you heard from our panel's introductions, they do represent various components of our homeless response system that are all so vital to getting people from that kind of first point of a housing crisis back to a place of housing stability. So thank you for representing and knowing that there's a whole team of other warriors behind each one of you. So let's start today with our questions for our panelists. And as much as we don't want to, let's go back 18 months to March of 2020, when all of us became so acutely aware of COVID. What was your biggest, most immediate concern or reaction to how do we serve those experiencing homelessness in the midst of a public health crisis? In January, I'm going to have you and William kind of kick us off with that question as two people working so intensely with those living unsheltered and those in congregate shelter.
Yeah, I think for me, my biggest concern was access. You mentioned it in the beginning, but just access, connection, and safety, I think were my three major areas of concern. How are they going to access information, food, shelter, other human beings, the resources? The library shut down, and that's such a major hub of resources for our folks who don't have homes. That's where they go to get information, to get maybe some quiet or some relief from the weather. And Horizon House is the same sort of connection access point for folks. And when we lost those, that's a big hit. Where are folks going to go to use the bathroom or charge their phones, get food, talk to other people? So that was really my biggest concern. Is access is crucial to everything, and that really just wiped it all out. And then safety, how are folks gonna stay well if they don't know what's going on, if they don't have access to PPE or hand sanitizer. So really those were my big three: safety, connection, and access.
And much like January, I mean, a lot of those same concerns. I think the biggest concern that hit us here at the shelter was health, right? In terms of, when it first came out, I mean, all you heard was death, right? You heard of people dying and not knowing anything. And then they start saying stuff like social distancing and wash your hands and wearing face masks. And right when I think it was, I always remember right around March 17th is kind of when it really hit, where everybody went into an uproar and panic. And at that time, we were in the middle or coming out of winter contingency. So, I mean, we had up to 400 guys in the building right at that time. And if you've ever been around here doing winter contingency and seeing how packed it is, you know that social distancing is just not an option, right? So, that panic of trying to figure out what we're going to do with all the people and how we're going to get them housed. And I mean, we couldn't, like January mentioned, everything shut down. So there was nowhere to send people. And I mean, we had to go into safety mode to get people, to places where they could at least have some semblance of social distancing, right? So we had a church that came online that we were able to put about 50 people in. Marion County Health Department was so instrumental in getting us some additional space. And once we kind of got everything calmed down after that initial first week, then that panic actually started to go way down. But when we first started, I mean, in a packed house, that panic, I remember having a meeting with my staff. And at that time, Dr. Kane or someone had talked about the process of people being locked into this building, right? Like nobody get to leave. You can't go home to your family. I mean, things like that. And I remember having a meeting with my staff to figure out who were going to fulfill those roles and who was going to be outside, and who was going to take care of things on the outside. And we had a plan. And when the pandemic happened, I think we just averted that whole plan. And our number one goal was making sure that we didn't care about ourselves necessarily at that time. Our number one goal was making sure that every single guest that we serve was able to be socially distanced, was able to be in a safe space. And then you start adding in the hand sanitizer and mask and things like that. So again, initially, it was just a chaotic thing because no one knew what to expect or what was going on at that time.
Yeah, I mean, again, imagine that situation, right? Where so many people just could hunker down at home, turn on the news and figure out like what's happening. Let's get that information and let's just kind of stay put. That's really hard when you don't have a place to be, right? And you're in a shelter environment, as you said, William, in the midst of winter contingency, which means you expand even more so than you do during the rest of the year. You had a full shelter of people. Social distancing was not an option right away. People were on floors, on cots. You opened new spaces, and all of a sudden, the guidance is you got to be minimum 3 feet apart, but ideally 6 feet. How do you do that, right? That kind of initial panic. Same for those living unsheltered, right? All the things you got to be doing, all the hand washing and really good hygiene and wearing masks. You don't have access to that all of a sudden because all of those places that were already scarce closed because that's what guidance was telling us. So how then do you start making those adjustments? How do you start shifting the work and to say, well, we've never been through anything like this, we've got to change our practices, we got to change the way we're operating, we've got to quickly pivot to keep people safe, alive, healthy. Nicole, what did that look like from your perspective as kind of the person that's really overseeing this whole outreach effort? How do you start pivoting and making adjustments to address some of the concerns January just named?
Yeah, so that's what I was going to reference was January's 3 main concerns: access, safety, and connection. So we quickly kind of coordinated a plan, and we're coming off the heels of the pit count, and we're at the end of the of winter contingency, and so COVID kind of just was that whirlwind when I think typically we could all kind of just take a break, and we just kind of jumped right in and coordinated a plan, and the city shut down, everything shut down, but we came up with this concept to develop a food distribution outreach project. We had limited street outreach capacity. Some of the agencies weren't able to lend their outreach workers to the project. So we did what we could with our limited capacity. But we had five teams who committed to this project to distribute food and water and essential supplies, PPE supplies, do the COVID screening, make those connections, ensure safety, and kind of be an access point. So we had 5 teams that were assigned to the 5 quadrants. And we worked very closely with the city and OPHS to get those supplies, food and water and PPE. And then we would pick those supplies up at was it Lucas Oil first? No, it was Bankers Life Fieldhouse first. And then we shifted to Lucas Oil. But so teams would pick up those supplies at the warehouse there, and then they would go to the quadrant and kind of route their day based on pinned encampment locations, distribute food, just check in on folks, make sure that everybody's doing okay, and try to address those concerns. So we kind of use that pit model just to, ensure that everybody was encountered at least once a day. And we worked collaboratively, like I mentioned, with those stakeholders and community partners. So I just want to acknowledge those PBSO team members that committed to that and worked really hard and did that day in and day out from March through the end of June. So yeah, we definitely had to pivot. It was unprecedented, of course, and so there were definitely challenges, and we worked through those. Like January mentioned, we would kind of identify needs or gaps in the response system, like hand washing stations and portable toilets and all of those things. And so we just kind of coordinated and communicated and figured out how to make those resources available to folks.
Thank you, Nicole. Again, the scale at which you all had to kind of adjust and then do this type of distribution was, one, amazing, but again, something you've never had to do, which speaks to the power of collaboration and coordination, right? Getting everyone to kind of come together with the same vision of like, here's what we need to do, here's how we need to do it, and let's just figure it out, which again is kind of wild when you think about working across agencies, across levels of government, all of that. And I think what you're describing is really illustrative of the power of our community and being able to kind of come together, no matter what agency you're with, to say, here's what we need, here's how we need to serve people, and let's figure out how to make it happen. And I think the work that you led with PBSO is such a great example of that, and keeping people's health and safety at the center of everything. As William mentioned, even though you all were so concerned about your own safety and staying healthy, I think that's something else important to note as you're listening to panelists today, and as many of us, were able to shelter at home and be at home for a little bit and work remotely. That could not apply to those doing outreach and those working in shelters. There was no shutting down. There was no, we can't go out, we can't serve people right now. And so you see people on the panel today that had to figure that out with their own safety and health in mind as well. So Melissa, you work at the front door, right, of the homeless response system. People that may not have come into shelter yet, may not be living in an unsheltered situation, but are very much experiencing housing instability or a housing crisis. What did you start seeing at the height of this in terms of the changing COVID environment from some of the individuals or families that were kind of coming in saying, help, I need help, I don't have stable housing right now, and I don't know what to do. I don't necessarily want to go into shelter. I definitely don't want to live in an unsheltered situation.
Right.
What were you experiencing? Yeah.
So like Chelsea said, the strategy of diversion is used at the front door. So for people who are within days of literal homelessness, before a coordinated entry assessment, before a client goes to shelter, anyone who is having a housing crisis can call into HIP, and they can have a housing problem solving conversation. We experienced an onslaught of need. In addition to changing our model, which used to be an in-person model, we went to serving people over the phone, and people were scared. They were stressed. They were worried about going to shelter and being in a congregate setting, but they were also worried about how to double up in close quarters. They were like families were stressed because kids had to quarantine at home or do school from home and parents couldn't work. So their housing was jeopardized. We saw a lot of people that were, you know, experiencing a lot of different housing crises, but they were also resilient. They learned how to navigate the system despite the circumstances, and they continue to be creative and find alternative solutions to shelter. The reality is that diversion conversation can really help, in connecting them to diversion resources can really help lower the need of people entering shelter. So the reality is diversion during a pandemic is crucial to helping lower the people who require a congregate setting. But the reality is also that diversion doesn't work for everyone. So being able to then connect people to shelter when there was reduced capacity became really important. So creating creative solutions with individuals and families to help them stay with friends and family so that we could create some sort of long-term housing solution became really important.
Thanks for that, Melissa. And highlighting, I think, the importance of diversion all the time, right? The goal is, if someone experiences a housing crisis, as much as possible to not have somebody have to step into shelter or live in an unsheltered situation, but try to intervene a little earlier, a little more upstream before that experience. But in the midst of a public health crisis, it becomes even more critical, right? Because as you heard from William, coming into shelter wasn't an option, as shelters were trying to reduce their populations and get people out of congregate settings. You can't have then more people coming in. And so that work became, I think, even that much more critical to do that kind of front door up front work. So what are some of the things, and this is kind of an open question, that you were hearing and seeing from the individuals and families that you were working with as you were getting more information to people about what was happening with COVID? What were you hearing and seeing? What was the reaction? What were the biggest needs people were naming?
I'll jump in on this one.
Yes, please share.
So I work in the housing case management side, so a little later in the process, but we got a lot of families, a lot of parents who were just in this situation that they had never experienced before, that their kids couldn't go to school. And that meant that they couldn't work. And which it was like a trickle down effect of, because I can't work, I'm at home with the children. How do I navigate the education system? They were still trying to adapt. That was one of the major crises that were happening for a lot of families, because we preach a lot about go to work, got to get employment, that whole conversation changed because we had to have compassion and empathy for our clients who were like deer stuck in headlights, like, what do I do?
From my perspective out on street outreach, like kind of like what I mentioned before, there were just a lot of questions about what was going on. Like you mentioned, Chelsea, we were bombarded with information. It was like constantly being streamed, or, you know, our phones or TVs or whatever. But for folks outside, there was a gap there in the way in receiving information. So there was just a lot of questions about kind of what was going on, what was changing. When the stimulus money came out, like helping folks get connected to that. So it was just a lot of questions. But I do really want to say, like, there was so much gratitude for a lot of folks that we saw. We were the only other interaction that they had was when we came out to deliver the sandwiches and the food. And outreach looked different. Like, we couldn't go and we couldn't really spend quality time because we had a massive amount of sandwiches to deliver. But still, there was so much gratitude that we were coming out. We were out there every day. and just, showing that we cared. The sandwiches were also, I have to mention, like, they were actually pretty decent too. And so just lots of gratitude for everybody to still be out there and working and checking on folks.
And I mean, and from the shelter standpoint, one thing that I was surprised about was that same gratitude, from the guests, right? They did realize that everybody had shut down, and the easiest thing that we could have did was shut down, right? I mean, I know at first everybody was expecting us to, well, what are y'all gonna do? Y'all gonna kick us out? Y'all gonna shut down? And when they realized that we were not doing that, and that we're doing everything in our power to get people moved and situated in different areas. I mean, that was, I remember thinking at the time, like, man, all we needed was a pandemic to get everybody on board, right? But I mean, everybody, all the guests were on board. They were helping out. They were moving around. They were doing, the things that they were supposed to. Now, of course, there was definitely resistance with mask and hand washing. Those things were super hard to kind of implement and to get people to do. But everything else from them being from them being cooperative and just doing their best to stay away from each other. I mean, I was actually really shocked that it had went that way.
It's really interesting that some of the things I think that you in January just flagged that we take for granted, not just housing, right? That we had places to go and be, but access to information. Again, I think we don't think about the privilege it is to be able to quickly get information and have information to help inform how we respond to things. And when you don't have that, if you're living unsheltered, and again, the places you would go to see a TV and listen to news isn't available, you don't have access to a smartphone that's constantly pinging you when there's new guidance coming out. That information gap becomes so critical, right? Because people don't know what's going on and they don't know how to find that out. And so you all become that lifeline, not just of meeting the basic needs, but to providing that critical information about what's happening in the world and why masks are important and why social distancing, where's all that coming from, right? And so you all became those kind of information links to so many people as well. So again, as you're all kind of working in these different spaces, kind of trying to figure out, how do we adapt? How do we respond? How do we keep people safe and healthy? There was also a need to make sure that the whole sector was coming together around this, right? And sharing, like, what are you hearing and seeing? How do we problem solve together? How do we come together as an entire response system to do this and to figure this out? Danielle, can you talk a little bit about, from your perspective, some of the ways in which the Indianapolis kind of homeless response system was able to coordinate and come together to adapt in this kind of new COVID environment?
Yeah, so I think one thing I guess my value to this group, I don't work at a shelter, I don't work on street outreach, but I think as we continue to focus on permanent housing and what does that look like, and I think that there were some immediate things that we had to make adjustments to. So our coordinate entry system, for instance, prior to COVID hitting, we were just starting, like it was like the week before we had started piloting online or phone assessments for coordinate entry system with one family shelter. And when COVID hit and everything shut down, it was, how do we continue to get people connected to permanent housing? And so really quickly, we were able to get all of our access points together and to talk about, how can we pivot? How can we shift? How can we create some policies and procedures around doing coordinate entry assessments virtually or doing them over the phone, much like Melissa mentioned with triage and having to do that over the phone. It's a very different method and a different way of connecting with people. So we were able to really quickly come together as a community and to establish call-in times where anyone in the community could call in to get a coordinate entry assessment, because obviously in this pandemic, distancing, isolating, being in your own unit is the best place to be in the middle of COVID-19. So we wanted to continue that, and we didn't want our housing process to stop. There were obviously a lot of hurdles. It's really hard to get the things that you need for clients like IDs and social security cards when those offices aren't open. But we wanted to make sure that we could continue as much as possible. So I definitely saw a lot of the community coming together around that. I think most recently, the biggest example of the community coming together in some very new ways is around our non-congregate shelter and our core rehousing team that we've launched at the non-congregate shelter to work on getting everyone housed from the non-congregate shelter. So I think we're really used to working, in housing. We're really used to working one program or one agency is granted a program, and they have a team that works specifically for that housing program. We had so much money that came from the CARES Act that we had to think differently because it was too much for any one agency to manage. And so how do we bring everybody together, and how do we have, a team of navigators, a team of document specialists, a team of case managers that are from several different organizations, and how do we all work together to work towards permanent housing in a way that's a little bit different and unique, and we're still learning and changing processes all the time to get better at that. But when you have so much rapid rehousing specifically, it's a different ball game. It's a way that we're using rapid rehousing in a way we've never used it before, and there's just so many players at the table. So I think being able to come together and not work. I work for this program. I work for this grant. I work for this agency. I'm here to help get everybody at this non-congregate hotel housed. That's our mission. It's really exciting to see.
Thanks, Danielle. And for those who may not be as familiar, non-congregate shelters were one of the emergency responses to COVID to help reduce congregate shelter populations, to allow for that social distancing and to have a safer place for people living unsheltered to come in. So these are the hotel sites that cities across the country, including Indianapolis, have set up over the last 18 months to provide those kind of private temporary spaces for people to be while getting connected to housing. And so Indianapolis has had several different hotel sites up and running over the course of the last 18 months. And the goal has always been, first, having a place for people to be safe and healthy in the midst of a public health crisis. It was a public health response. But then second, to make sure then people are getting connected to housing so that they're not going back to a sheltered experience or to an unsheltered experience. And so how do we really come together around that? So when we look at that, we've spent some time highlighting some of the biggest concerns and challenges that COVID have highlighted at this intersection of homelessness and health. But we've learned a lot too over the last 18 months as you all have pivoted and shifted work and adapted to this different environment. Looking back at the last 18 months, what are some of the things that you're most proud of in terms of our community's COVID response and the kinds of work that's being done to keep people safe, healthy, and then on the path to housing? And this can be for anyone.
Mhm.
Go ahead, Shay.
Oh, I was gonna hand it over to William. Go ahead.
And then William, jump in after.
I'll go
Well,
next.
Okay, I would say I'm definitely proud of all the case managers that have come through this and come into this, the entire community partnership since it started and during the process. Because not only do the case managers work with these clients while they're being housed, but for 2 years or years afterwards. And so just continuing to, even when they have their own families, their own situations, health issues, et cetera, and they continue to, if it was working from home, working from site, just adapting. I was very proud of just the housing piece as well. So not just HIP's housing team, because there are lots of housing teams working to continue to put people into housing, but I saw a housing team that went out there and adapted like amazingly. Like everything's closed, But we were like, okay, well, let's just adapt. How do we get people still moving into housing with the whole city shut down? We were contacting landlords and doing virtual tours instead of walking through apartments. There were times we were loading up cars, vans, moving people from here to there to get them into the housing, still showing up for those lease signings, faxing paperwork back and forth, taking pictures of what needed to be taken care of and getting it to where it needed to go, so that we could move people from homelessness to housing in the midst of a pandemic.
And I would piggyback that, right? One of the biggest things that I really saw during that time that I am really proud of is the collaborative effort of everyone. I mean, everybody jumped in, even though, you know, some working from home, some working from out of town. I mean, everyone jumped in and was willing to kind of keep things going, right? That first couple of weeks, yeah, a lot of stuff shut down, but as soon as everybody kind of got a handle on it, I mean, I started getting iPads and phones and things like that so that we can do virtual meetings and virtual interviews and things like that. So, you know, that really put a smile on my face to know that, hey, you know, we're not in this alone. Everybody's in this collectively. And I think the biggest thing that I've been proud of, even to now, was the number of cases that we did not have, right? One of the things that everyone expected was for us to have major outbreaks in the shelter. And we did not. I mean, we have some cases and there were a lot of people, but nowhere near what anybody expected. And I think, to my knowledge, from specifically from the shelter, I think we only lost 2 individuals, right? And I think one of those individuals just decided to leave because he didn't want to be here. But you know, I mentioned in the beginning that when panic set in, our number one goal was the safety and safety of health of everybody, and for us to not have as many cases and deaths and anything like that, as other people were seeing those things. I mean, I was most proud of that because again, that took a collaborative effort from everyone to make that happen for those individuals experiencing homelessness.
Absolutely. And William, I think that's no insignificant thing that you just named, that we did not see the kind of infection and death rates here in Indianapolis among those experiencing homelessness that so many other cities saw. And it's absolutely a testament to the quick and creative work that you all have done to problem solve and to put health and safety and people at the forefront of all of this. So as we start to get towards the end of today's discussion and want to have some time if there's any questions from participants today, what are some of the things, if you look back, that we've done as a community in response to COVID that you think, regardless of a public health pandemic, we should keep doing these things? They've opened our eyes to some new ways of working or new opportunities. Who wants to talk about some of the things that have come out of this crisis that we will continue regardless, because we've learned some good things from them? Melissa, I saw you come off. Do you want to jump in?
Sure, just real quick. I am just so excited that our community has embraced the idea and strategy of diversion. We are making huge strides in working towards a community organized response that can help reduce the number of people entering shelter and experiencing literal homelessness. Thanks to the help of CHIP and United Way, we are really working hard on figuring out how to help core organizations support people at the front lines to help people with creative problem solving. So stay tuned about more coming down the pipeline.
I'm going to give a very social worky answer, and I apologize, but that's the only thing I can do. So I think there's a lot of stigma behind homelessness and how people become homeless. And although I don't want anyone to experience any financial difficulty, a lot of folks this past year, because of the shutdown and job loss, have experienced some financial insecurity. And I would hope that from that, again, I don't want anyone to struggle, but I I would hope that people learn how close some of us are to facing housing instability. A lot of us are a lot closer than we necessarily want to acknowledge. So maybe decreasing some of the stigma about how you become homeless. And then also the homeless folks are hidden, right? They're out there. We don't see, out of sight, out of mind. And when we reached the point in the pandemic where everyone was on the circle because they had nowhere else to go, then it was a problem because it was in our face. And so just remembering that there are folks out there, they're struggling, and even though you can't see them, and we're all working so hard every day to prevent it, but maybe just more advocacy. And then really what everyone has said, especially what Danielle said, the way that different agencies just came together, and it wasn't about who's going to get credit for this or who, outcomes, or it was just, like Danielle said, get it done. Like, this is a problem, get it done. And it was so fast. It was so fast the way like people came together. I'm really proud of Indianapolis and the way we handled everything. So
I'd like to just quickly, I want to give a social worky answer. I will have to say that hotel model that we learned a lot from, as far as using hotels and motels as transitional housing or even shelter. I would love to see that further developed. I would love to see the city jump into that. It would get a lot of people off the street.
I want to jump in and say something that I hope continues, and I have a feeling it really will, is pulling the strengths of the individuals that are already in our system and kind of elevating where we each have expertise and experience and knowledge and talent, and driving on those. So some examples that I want to bring up. I think with Social Security, it closed. It was really hard to get Social Security cards. Amanda Elvis stepped up and said, I have a really close relationship with the person at the local office. I can be that person in our community that helps coordinate that. I've seen Lindsay Leonard do that with getting IDs through the BMV. I think we know that Wheeler runs a really awesome hotel or shelter operation system. So we should be leaning on the experts that are within our community and the skill set that we already have. And I think the more that we can kind of streamline and elevate where our strengths are and lean on each other for those strengths makes us better as a community. So instead of feeling like we each have to figure this out on our own, every single person needs to know everything about our system. That's not the case. We have specialists, and we have really strong talent and expertise in our system, and we need to pull up those strengths out of everybody. I think hiring document specialists to only focus on documents is a really good move for our community. I think that takes off a lot of the burden and the ease on people who are already strapped trying to do case management and trying to find units. So the more that we can kind of individualize and specialize our roles in our community and have them more system facing and to be able to fill gaps that everybody can utilize those strengths is really helpful. And I want to see that continue.
Yeah, so I'm hearing a couple big themes that hopefully those listening in today kind of take away from what have we learned, because this has been a huge, I think, learning opportunity. And I've heard that kind of more front door work, right? That coordinated community-wide strategy around diversion, so that we have fewer people that are needing emergency shelter or that find themselves living in an unsheltered situation. And Melissa, thank you so much for the work that you're leading around diversion. I'm hearing, Shay lift up this model, and William has lifted up this model of like housing focused non-congregate sheltering. How do we reimagine sheltering in a way that provides different kinds of situations for folks, and that is that pathway and pipeline to housing. And let's look at that. Let's look at how the hotels and motels have been used, and not just as a facility, but then how they've been operated and the teams that have been working there on site. So much to kind of take and glean from that. More visibility and awareness that January is lifting up, right? Like, we need to destigmatize why people experience homelessness. And I think this last year has definitely created maybe more visibility and awareness of the issue of homelessness as again, downtown shut down, and guess who's out there? Guess who's left? And understanding that it's really systems that have failed people, and really naming those things. We have to look at why people don't have access to housing and how our housing systems have not been serving people well, and how close so many are to that kind of brink of losing housing and having a homeless experience. And I hear having kind of that option to name roles and name the talent and skills across this homeless response system that so many of you today embody. And how do we keep supporting and lifting up the talent and skills that are out there? And really kind of saying, we don't have to all do it all. Let's figure out what each kind of person and organization is really good at and do it collectively. And again, I think that's what you all have demonstrated so beautifully these last 18 months that will continue moving forward. So I know we're 2 minutes short now, and I think we could probably go on for a lot longer because of the expertise and experience you all bring to this. So what I'm hoping is that for those on the call today, look at the names and faces of the panelists you heard today and connect. There's more connections to be done. Reach out to learn more about the work that they're leading and involved in, and how you can get engaged and involved or support their work. I'm sure all of you have ways in which you could ask for more support. Here's how you keep lifting up these things we're doing. We'll share everyone's contact information for those who want it and need it and want to connect more. I haven't seen a lot of questions in chat, so maybe things will come out as you process this discussion. And if so, I do hope that you reach out to the panelists and have this continued dialogue. So with that, I would like to give the warmest thank you to our experts today, Melissa, Shay, William, January, Nicole, and Danielle. If everyone on the call could do a little clap emoji. Thank you to the panelists for sharing a little bit of insight to what these last 18 months have looked like, meant, and most importantly, how we've come together to keep people safe and healthy and on a path to housing, which is what keeps people safe and healthy in the long term. Thank you for the work that you continue to do and lead in this community. And let's keep coming together in these ways. So with that, again, a huge thank you to all of you. We have a second Lunch and Learn coming up in October. We'll make sure to get this out to continue the dialogue around education and highlighting the great work happening here in Indianapolis. So our next Lunch and Learn will be on October, let me double check the date, October 27th at noon. And the topic is leading from experience, engaging peer specialists and peer supports within the homeless response system. Those who've lived it and been through it are the ones who know what works, what doesn't, and how we need to move forward. So I hope you can join us then. And thank you for your time this morning. Oh, this afternoon. I've lost track of time. This afternoon. Thanks so much, everyone.